watching Let's Chat.
As we all travel through this COVID-19 pandemic together, one thing that's at the forefront of everybody's mind are when are our healthcare facilities going to be safe again? Here to answer that this morning is Don Mueller. Don is the CEO of Children's Hospital at Erlanger. Don, good morning.
Good morning.
Don, tell it to me like it is. Are our hospitals now safe?
Part of the messaging I want to make sure everybody hears is that the hospitals are very safe. We are taking every precaution we possibly could to keep our patients as safe as possible. We are temperature checking people at the door. We've got restrictions on visitors. We are all wearing masks all day long in the hospital and goggles as well. We're separating out our COVID patients from other patients. The hospital is as safe as any place in the community, if not more safe than going to the grocery store or the hardware store.
So what are your thoughts as a CEO about reopening such a monumental medical facility as Children's Hospital is?
Reopening is extremely important for all of us. We all have healthcare needs. One of my major concerns right now is the fact that people are choosing to stay away from the hospital because they have worries about catching COVID. We've seen a dramatic decrease in our emergency room utilization on the children's side as well as the adult side. The children's side is down 70%, the adult side is down 45%. And what I worry about is delay in care. So before we get to reopening, I want first people to understand we are open for business. If you're having a healthcare emergency that requires emergency room services, do not wait. Just come to the hospital. We will keep you safe.
Why do you think these numbers are so far down? You said 75% and 40%. Why so much?
Well, I do think social distancing is helping to keep kids sick. From getting sick. We're also not participating in team sports, so we're not having the sports-related injuries we normally have. So there are some positive things about it. What I'm really worried about is delay in care. We've had some parents who have chosen to not come to the hospital when their children needed it. As a result, one child had a broken arm and didn't show up for quite some time because the parent was worried about COVID. I'm worried about adult patients who may have signs of a stroke or chest pain, and they are reluctant to come to the hospital, and then we have mortality out in the community that doesn't need to happen. So I think the message I want people to hear is the hospital is a safe place, and if you have emergency level care that you need, please come to the hospital.
Now, Erlanger has always been sort of at the forefront of telehealth when it comes to medical care. You're still offering this, I presume.
Telehealth is probably the best thing that ever happened because of COVID. And I know that sounds a little strange. All of the restrictions around HIPAA compliance and some of the billing restrictions went away for a period of time. We've seen more than 1,000 pediatric visits via telemedicine across all of our service lines. So there's a lot of healthcare that can actually take place via telemedicine. It's very efficient. Parents can stay at the house. The kids don't have to miss school if they were in school. We can do a great exam. A lot of this is great for medication management or just management of chronic disease. There are some reasons that you would need to be seen by the doctor and physically seen, and we are open for business to do that as well. But we've got screening protocols in place. So if you have an appointment, what we'd want you to do is call, and if you're well and you want to come in to see the doctor, that's fine. But we can also offer you a telehealth visit if that is more convenient and makes sense for the type of care that you need.
Sometimes people may not want to acknowledge this, but the further you put off going to a doctor, seeking medical care in person, the worse your condition can get. So it's important that you know that the facilities we have, such as Children's Hospital and Erlanger, are open, and they are open safely. Correct?
You are 100% correct. All of the emergency rooms across Chattanooga are open, Erlanger and others. And I just, the major message I want people to hear is that if you're having a problem and you need emergency room care, don't wait because you're going to end up getting a lot sicker. A lot of these respiratory problems, if you wait, kids can crash really fast. It's important if they're having trouble breathing that you get into the hospital as soon as possible because that's why we're here. We're here to help take care of you and your families. And we don't want you to be scared of COVID. We want you to think about the emergency that's at hand and get it taken care of.
Don, thank you so much for your time this morning. We appreciate the clarification on what's going on at both Erlanger and Children's Hospital. We hope you will stay with us. We will be right back after this.